The modern healthcare system won't help you heal.
It's designed to keep you sick and dependent on drugs.
If you want to get well, you gotta get out of the system.
You found Predictive Health Clinic.
Join us as we get well and stay healthy.
Welcome to Predictive Health, folks. I'm glad to have you here today. I'm Jack Heald, and with me today is Dr. Lawry Han, who likes to go by Dr. H. So let's jump right into it, Dr. H. What one specific health issue do you want to address today?
I want to talk about glucose control and weight management.
Okay, you gotta explain that for us. The weight management we understand, but whatever the other thing was, that's okay.
Okay, yeah, glucose control, which means how to manage your blood glucose level. Body weight management is already very familiar people with in those days, and specifically, I want to talk a little bit more about body weight management and its relationship to GLP-1 hormone. I want to primarily focus on body weight for this podcast.
All right.
GLP-1 stands for glucagon-like peptide 1. GLP-1 is a hormone primarily produced in the small intestine and plays a pivotal role in regulating blood glucose levels and when you consume food, especially carbohydrates, for example, GLP-1 is released to stimulate insulin secretion, promoting glucose uptake by your cells, and thus reducing your blood glucose levels. It's a very natural process. GLP-1 also suppresses your appetite by interacting with your nervous system. When your appetite was suppressed, you don't feel like you want to eat more food. You feel like you want to eat less, and you do eat less. If everything else stays the same, when you eat less, you lose weight. GLP-1 also slows your gastric empty and the bowel movement.
It slows it?
Yeah. Slows gastric empty and the bowel movement.
Does this mean you get more nutrition from what's there?
That probably not necessarily the case.
It just slows you down.
Yeah, I don't think we have done extensive studies on that aspect. It just slows down the process, which means your food, they longer in your digestive tract, right? So you feel fuller for a longer time, right? So you don't need to eat that much food, and naturally it helps with body weight loss, right? So that's a very natural process. So all of those effects and the impacts of natural GLP-1 help people control their blood glucose level and help people lose weight. However, I want to mention something. Many of you probably heard about the so-called miracle GLP-1 weight loss drug. That's
actually why I got interested in what you were doing. You mentioned GLP-1, and I know that's huge right now. For Ozempic is the one that comes to mind, but I think there's others as well.
Yeah, the chemical compound that name is called semaglutide. There are different versions of the chemical compounds, but essentially those so-called GLP-1 drugs are a class of medications that mainly help manage blood sugar or blood glucose levels in people with type 2 diabetes. Some GLP-1 drugs also help with obesity. They become so popular that people even call those miracle GLP-1 weight loss drugs, right? Those drugs actually mimic the action of the natural hormone GLP-1, which is released by the intestine in response to food. They work quite well for the purpose of controlling blood glucose level and for the purpose of losing some weight. However, they come with a long list of side effects. I'm sure we will talk about this later, a little bit more in details later. This weight management, specifically obesity and its relationship to GLP-1 natural hormone. This is the topic I want to focus on for this podcast.
What got you interested in GLP-1 and its relationship to glucose management and obesity and weight loss?
Oh, that's a good question. How many hours do you have? Let me try to explain it in 5 minutes. And so I want to be thorough, but concise. So first, I have always been interested in human health and helping people improve their health and wellness. I have worked in different sections of the human health sector, including pharmaceutical, medical device, and then nutraceutical products. My earliest research related to hormone signaling went back to when I was doing my PhD training at the University of Utah, which is about 10 years ago. Ever since then, I have realized the ubiquity of hormone signaling across the species and of course including humans, and also the importance of hormone health to overall human health. Over the past 10 years, I've been actively researching and developing products to help people manage and improve their health, including, of course, hormone health, such as glucose control and weight management as well. As of now, I have developed over 100 products, published 40 peer-reviewed scientific medical research papers, which have been cited 1,000 times by peer researchers, of course, about numerous patents in the human health sector. It's really important to note that our industrialized, sedentary lifestyles have disrupted the health of our society, especially people's hormones. We humans now tend to overeat and gain unwanted weight, not sleep well, overuse, even abuse medications that can cause serious addiction. That was why I founded a biotech and a research company to specifically help people achieve optimal health by restoring their hormone balance and revamping their hormone health. As for specifically what got me interested in this particular issue of glucose control and weight management and GLP-1, the problem was that products in the marketplace have failed in delivering the expected outcome.
Sure.
Products such as meal replacements, nutritional shakes, and supplements often come short of. Fitness and dieting programs are really hard to stick with, and thus not sustainable at all. Weight loss drugs, such as the popular GLP-1 drugs we just talked about, including Ozempic, Wegovy, and Robitussin, they come with a long list of side effects, including thyroid. Of course, they're extremely expensive. They're about $1,300 each month without insurance, and they also need doctor's prescriptions for you to get, and that's very limiting. So that was why I wanted to introduce something that is safe, nature, and effective for glucose control and weight management. So I have been working on this product called Monoline for quite, which is specifically designed to signal the human body's natural GLP-1 hormone. I filed a patent on this GLP-1 signaling technology. We completed a 12-week clinical study on Monoline. In this study, Monoline reduced fasting blood glucose level by 9% and reduced the hunger level, means the feeling of hunger, by 42% in those overweight adult women and men. Over the course of this 12 weeks using Monoline, both people also saw on average 8 pounds of weight loss and 19% of body fat loss. So these are really exciting and positive results. We are in the process of publishing this study, peer-reviewed scientific and medical journal, so everyone can have access to it. So stay tuned.
What's the biggest popular misconception about, I realize obesity and weight loss is a broad issue, but your specific focus of dealing with the hormonal root causes that generate outcomes of obesity and all of the negative health situations associated with that. What's the biggest misconception there?
The biggest popular misconception about obesity, weight management, or failing to manage one's own body weight, people think it's a problem of lacking willpower. That's completely wrong. It goes way beyond lacking willpower or not. So we already know that there are many factors that can cause people to overeat, cause people to move less, and eventually cause people to gain unwanted body weight. It's extremely complex process that goes beyond willpower So it's unfortunate and unfair to blame people for lack of willpower simply because they cannot manage their own body weight.
That's actually a very hopeful statement.
Obesity and weight management is a very complex problem that definitely needs a holistic solution. So it's a lifestyle matter that needs attention not only from the individuals, but also from our community and the bigger society. So I think we all agree that each individual person is responsible for their own health, including body weight. At the same time, it's also critical to understand that no single treatment, or specifically no single medication, is a cure for obesity. Now, this almost feels like cliche now, but healthy lifestyle is the most effective way for weight management. So now, what is a healthy lifestyle? In my opinion, there are 5 major components. So first, you want to make sure you sleep well, right? So it's generally recommended a grown-up need at least 7 to 8 hours good quality sleep each night. Sleep is very important for overall health. It's also very important for you to manage your body weight. It's counterintuitive for people to think that, oh, you sleep more, that can help you lose weight. But it's true. People who do not sleep well, they tend to gain unwanted weight. People who sleep well, they tend to lose weight more efficiently. Second, eat well. Eat means you need to eat diverse, balanced meals, specifically including colorful, non-starch vegetables and fruits. This is very important because most Americans do not eat enough non-starch vegetables and fruit. 3, exercise regularly. Ideally, combination of cardio training and resistance or strength training. So it's recommended an individual to exercise at least 150 minutes for those moderate to vigorous intensity exercise. So that's not a lot. It's about 30 minutes each day if you are doing this 5 days a week. So any type of exercise is actually good for your body. Number 4, reduce stress, especially chronic stress. Chronic stress can also cause you to gain some unwanted body weight. So try to reduce your stress to a level that you feel comfortable with. Number 5, if you're already doing number 1, 2, 3, 4 pretty well, you can do something else to further up your game. For example, use some effective products for actual health. When I talk about products, not only talking about physical products you can take or use, but also include, for example, protocols or routines that can help with your goals. Wherever you are using product, you want to make sure those products are high quality, they're scientifically studied, they're clinically proven. But what's more important, and eventually, you need to make sure it works for you because everyone is unique and different. The product that works for someone else may or may not work for you. Bottom line is that you want to use products that are of high quality, scientifically studied product.
Sounds good. All right. Our next question is, what's the likely outcome if people don't take action? I think most of us know it, but you're speaking as a scientist, so answer as a research scientist.
There's just so many bad outcomes. Obesity can cause a lot of problems, including many life-threatening diseases. Just to name a few: Parkinson's disease, Alzheimer's disease, heart disease, and many others. Eventually, it can also shorten your life by 10 years or even longer. It can also cause a lot of burdens to yourself and your loved one beyond the health consequences. You're more likely to suffer from other diseases, thus more likely need care from your loved one. Diseases cost a lot of money, so you and your loved one might suffer from financial challenges, especially in the face of disability and hospitalization. This is really staggering the gift. Those are the major types of negative outcomes if people do not take action. Those are the primary ones I want to share.
Those are the big ones. All right, so let's move to answers. What is the one specific action that our audience who's dealing with this particular issue that you recommend that they take to avoid or recover from this particular issue?
As we talked earlier, I think we all agree that each individual person is responsible for their own health, including body weight. No single treatment, or specifically no single medication is a cure for obesity at all. Period. Healthy lifestyle is the most effective way for weight management. This is really good news because it means there are a lot of things you can do to take care of your own body weight and your own health. I strongly recommend the product we recently developed, which is called Monoline. Monoline is carefully formulated with seed, the natural ingredient, which is clinically proven to signal your natural GLP-1 hormone and thus supported glucose control and body fat loss.
What's the best compliment you've received? What's the best thing you've ever heard about your work?
I'm a scientist and a researcher. I work on products. I work on science and research. So the biggest compliment I got is when the product I researched and developed really helped someone to improve their health. So that's probably one of the best parts I love about my work. The purpose has always been using our research, using our science, using our products to help people improve their health and wellness so they can live healthier and happier lives.
What's the most common complaint that you get?
Yeah, by the way, I got a lot of complaints as well, especially something is not working in the way of protein effective, right? It could be that a product is not as effective as they hope, or it could be that there are some side effects they do not like. Sometimes there are very good reasons for this complaint. However, oftentimes it's primarily disconnect between consumers' expectations and what the products can really do. This is always something we as product researchers and scientists try to close the gap for and improve on. Over the past few years of extensive research and development experience, I found that oftentimes the most effective and the least complaint products are the ones that are not only safe and natural, but also clinically proven. We only use natural ingredients that have been in the food supply chain for a long time and proven safe for human consumption. Everything needs to work seamlessly with your body, specifically with your body's natural response and the regulation, not against your body. Second, we research and source our ingredients directly from nature. And third, we often seek inspiration from nature. Do you know that only less than 5% of identified plant species have been studied for their medicinal value? Yeah, less than 5%. So there's so much to explore further. Nature molecules, which are designed by nature of course, have constantly won over even synthetic molecules. They're just simply better and fit. Nature has been the best master of harmony.
Let's close it with the question that we always like to ask. If you could deliver just a single message about health in 8 words or less, what would that be?
For obesity, use safe, natural, clinically proven product.
Dr. Lawry Han, thanks for joining us. We will provide the contact information for Dr. Han and his company in the show notes.
Are you a healthcare practitioner eager to escape the grind of corporate medicine?
Are you ready to make a massive difference in your world? Listen up.
We are the Wizard of Ads.
For 40 years, we've created dominant brands in a variety of industries.
Now, we're bringing our magic to healthcare.
We're seeking one extraordinary healthcare practitioner to help us build the first national brand in direct primary care.
If you think you could be that person, let's talk.
Email us at health@wizardofads.com.
Tell us why you think you're the one.
That's health@wizardofads.com.